Good morning. How are you, beautiful people? It is so wonderful to be here. I want to thank the organizers for inviting me to come today from Chicago. I've only been to Kentucky a couple times, and I'm sad it's raining, but I'm so happy to see all of you. You brave the weather. I want to give you a perspective of the type of research that we do in Chicago, because I agree with that video. The video was so inspirational, wasn't it? University of Kentucky, the center here is top notch, and anything you can do to support them will help all of us in the Alzheimer's field. So please continue to do what you're doing. So my talk today is about factors that shape brain health and risk of Alzheimer's disease in older adults. And let's see if I can figure this out. Okay, so just by way of a background, I'll just give a very short introduction, and then I'm going to talk about some of the studies that we have at Rush, where we are studying normal cognitive aging and transitions to Alzheimer's disease. And then I'll talk a little bit about some of the factors that we're finding that shape brain health and risk of Alzheimer's. And by that, I'll be highlighting some key prevention strategies to consider for your brain health, because I think it's important that we do something to alter our own behavior so that we don't get this terrible disease. So we all probably understand and know that dementia is a growing health concern for our aging population. Today, 1 in 8 older Americans over the age of 65 years of age are affected by Alzheimer's disease and other dementias, and it's a very costly disease, about $200 billion a year. And with the projected population increases in the oldest age groups, because that is the group that's aging the fastest, about 13.5 million people in the US will have Alzheimer's by the year 2050. That is less than 30 years from now, right? So prevention is a public health priority. I know that we all know about what dementia is. It's an umbrella term used to describe a range of symptoms associated with cognitive impairment. But of course, I don't have a pointer, but Alzheimer's is the little blue person. It accounts for the biggest proportion of people with dementia. But you can get dementia for many different reasons. And today I'm going to just be focusing on Alzheimer's disease. So Alzheimer's disease is common. It's a chronic condition of aging, usually of older people. It's the most common cause of dementia, and it's characterized by slow onset and gradual progression of memory problems, followed by impairment in other thinking skills. Importantly, it's not a normal part of aging, and we know there is no cure. And although there are treatments that are on the horizon and are available now, and you'll hear more about that later today, if we know the factors that shape brain health, can we prevent Alzheimer's? That's the main question that we're interested in. So how do we prevent Alzheimer's or slow cognitive decline? Well, you have to be able to identify risk factors, either genetic risk factors or things in the environment, so that you can determine the biologic pathways linking those risk factors to your clinical symptoms. And in that way, you can develop strategies that will allow you to prevent it by either altering behaviors or finding ways that we can develop therapeutics for the disease. So that's what our goal has been at the Rush Alzheimer's Disease Center in Chicago. Another way to think about this is that you have what we think of as healthy brain aging, right? So we all want to be the straight line as we get older. And I met this young 94-year-old today who is a great example of healthy brain aging. But we know that most of us are going to experience some change in our cognition as we get older, right? And some people will experience a more rapid decline, and others will decline a bit more slowly. But we want to understand what determines how fast you go on this trajectory. Are there some things that we can identify to say you can slow it or you can just not experience cognitive decline at all? So at Rush, we have a number of different large longitudinal cohort studies. I'm only going to talk about 3 of them today. That's where the data will be coming from that I'll be talking about. We have the Religious Order Study, the Rush Memory and Aging Project, and the Minority Aging Research Study. So let me tell you about each of these studies one at a time. The Religious Order Study began in 1994, and it consists of over 1,500 older nuns, priests, and brothers who come from across the United States, and they all enroll without dementia at the first visit at baseline. They also all agree to have an annual clinical evaluation and to give their brain at the time of death. That is a requirement for the study. The study is about 92% white Americans, but we do have 3 African American orders, one in New York, one in Baltimore, and one in New Orleans. And we also have 1 Latino order in San Antonio. About 30% have developed Alzheimer's dementia since we've been following them. Remember, everyone enrolls without dementia. So about 30% have converted. People come from across the country, and those red dots represent where people live in their convents around the world, around the US. And we send a team from Rush to these different places to go and test the participants and then bring the data back to Chicago. But everyone in the Religious Order Study, they're very highly educated. Most of them were teachers, just like maybe 21 years of education. And they live together communally, eating the same foods, having very similar behaviors. So sometimes it's hard to generalize to the broader population based on what we find in the Religious Order Study. So we have another study called the Memory and Aging Project, which consists of lay people like us in the room. And this started in 1997. It consists of over 2,200 older persons. Again, they all enroll without dementia, and they come from northeastern Illinois counties and in Illinois. They all agree to annual clinical evaluation, just like the Religious Order Study, and annual blood donation, but they also have to give, or not have to, but they agree to give their nerve, muscle, spinal cord, and brain when they die. Again, it is a requirement for the study. The study is approximately 93% white, and about 25% have developed Alzheimer's dementia over time. So this is what it looks like when we go to these memory and aging project sites. They also live communally in these continuing care retirement communities. And so we send a team there, we test the participants, we bring the data back to Rush. So, a more generalizable study, right? Because they're just lay people like me and you. But both of these studies are predominantly white, and we want to understand Alzheimer's in everyone. So we started a study called the Minority Aging Research Study in 2004. This is one of the studies that I lead, and it consists of over 800 African Americans over the age of 65 who also enroll without dementia. We recruit from the community, so we recruit from churches, senior buildings, and organizations in Chicago that cater to older African Americans. They all agree to annual cognitive testing, risk factor assessment, and a blood draw. And about 10% have developed Alzheimer's dementia since we started. Now, because it's an African American population and there are challenges in requiring brain donation for this type of a study, brain donation is optional for this study. And so we've had about half of the participants have agreed to give their brain at the time of death. And so, these studies, together are really helping us to understand a lot about aging. And so, our African Americans don't tend to live in retirement communities. So our participants come from single family homes, apartment buildings, but just like the other studies, we send our staff to people's homes to do the testing and then bring the data back. It really removes barriers to people being in research because they're in their own environment, they're comfortable, they feel like, they don't have to navigate a complicated health center. So that has been really helpful for us. All 3 studies follow the same design. So we enroll people without dementia at the baseline visit. We measure a host of different risk factors, things that we think might be important that we've learned from other studies, we've learned from the literature. And then we measure their thinking skills every year, annually on an annual basis. So time passes and they're in the study for as long as they want or until they die and give their brain. And over time, some people will develop dementia or mild cognitive impairment, but many people will remain healthy and free of dementia. And so we want to be able to understand what are the risk factors that will determine whether someone converts to dementia or someone just declines rapidly over time. And that's what our goal has been. So when we're studying people over many years, and we plot their trajectories of aging, this is what it looks like. A huge spaghetti plot, right? It looks like all kinds of stuff is going on. This is just showing you that there's a lot of variability in how people age. Some people start off really, high and they decline quickly. Others decline more slowly. Some just stay really stable, and we're trying to understand, can we pinpoint what risk factors are determining who moves, how fast they move, and whether or not they convert. So the question again is, can Alzheimer's disease be prevented? And can we slow cognitive decline? Because I know for me, I don't want to take a pill for Alzheimer's. I'd rather just never have it. So let's figure out how we can prevent it, right? That's probably the best course. So we know from our research and from others across the world that there are so many factors that can impact your brain and your brain health. And many of these conditions are in the environment where we are born, where we grow, where we work, live, and age. These are called social determinants of health. And we and others have shown that the type of neighborhood you live in, the experiences that you have from early life, whether they're good or bad, your educational experiences, what type of school you went to, whether you attended a school that was legally segregated, how you handle stress, your access to healthcare, all of these factors can impact your brain and how you age. And some of these things you can control, some of these things you cannot control. So if we know that these factors across the life course can shape your brain health, is there anything that we can do? What can we do? A recent poll by AARP was done, and they found that 98% of adults 40 years and over believe that brain health is very important, but only 56% are actually doing the important activities to support brain health. And the barriers that came out of that poll was that people don't know what benefits the brain. And number 2, people have people in their environments around them that might make it hard to change, right? So think about if you're going to go on a diet and you're going to say, I'm going to stop eating all these cookies, but you have people in your house who keep bringing cookies in because they love cookies. It's really hard to change, right? So that's a real barrier. And so how can we figure out what we can do so we don't have to deal with that? So I'm going to show you some results from our RUSH studies of things that you can actually do to protect your own brain health. So I told you that we go to people's homes, we ask them all kinds of questions to measure the risk factors. One important risk factor that we have been looking at is cognitive activity. We ask people questions like, how often do you read books? How often do you read magazines or newspapers? How often do you play games or board games like crossword puzzles? And we ask this, every year, and then we calculate, the frequency that people participate in these types of activities. And we found, like many other studies have found, that More frequent engagement in cognitive activities actually is related to a reduced risk of Alzheimer's disease and a slower rate of decline, but importantly, it can delay dementia onset by about 4 years. I'm showing you here a graph that has people separated into 3 different categories. People who participated in cognitive activities at the lowest level is shown with the black line. People who participated at moderate levels is shown with the red kind of dash line, and people who participated at the highest level is shown with the green line. And this is showing you the probability of being dementia-free. So people in the green line, those are people who are doing these activities at the highest level. So they're reading lots of books and magazines and doing crossword puzzles. They stay dementia-free for a greater proportion of the time, and it's pushed back by about 4 years. So that's something that you can actually do. Anybody can read a book, or listen to a podcast, or read a magazine or something like that. These are simple things that people can do to protect their brain. Now, what's another thing that we can do? Something that you are all doing right now. This is actually considered a social activity. It's also a cognitive activity because you're listening and getting information, but we're all sitting here together, enjoying each other's company. It's a social activity. So we asked people in our studies, how many friends, relatives, neighbors do you see at least once a month? And people who reported seeing more friends and family, having more contacts in their life, they actually declined at a much slower rate. So the top line is showing you people who reported having a high social network, and the bottom line is showing you people who had a low social network. So you want to be in the top line. You want to have lots of friends and family, and not the toxic friends and family. You want to have the good friends, the good family members. Those are the people who are going to keep your brain healthy. So get rid of all those toxic people out of your life. Call them up and say, I'm done with you, and just have your good friends. Now, we also ask people, how often in the past year did you do these types of activities? Go to restaurants or sporting events, play bingo, go on day trips, do unpaid community or volunteer work, visit relatives or friends' houses, participated in groups, attend church or religious services. And people who reported doing more of these things have a higher level of social engagement. There are some people who don't do any of these things. They're socially isolated, they're lonely, right? That's a risk factor. And we saw in our study that those who reported having more social engagement actually declined slower, a 70% reduction. So just doing activities is a protective factor for your brain. So you, again, want to be that blue line at the top. You want to be that person who's still being active, who's still going out and getting things in your environment, or having people come to you. You don't have to just always go out, but it's about being with people, being socially connected. What is another factor that we have been investigating is diet. And I know all of you had that breakfast today. I hope you ate your fruit. We have something that we established at the Rush called the MIND diet. I know you've all heard about the Mediterranean diet. There's also something called a DASH diet, which is for hypertension. But the MIND diet is a combination of the Mediterranean and the DASH diets, but it emphasizes foods that we think from our observational studies are important for brain health. So it includes things like leafy green vegetables, specifically leafy green vegetables. Vegetables are good for you in particular, but we really emphasize leafy green vegetables. Berries, especially blueberries, are really the only recognized fruit in this diet. And having fish at least one time a week, and not emphasizing dairy, butter, things like that, or sweets and pastries. So we ask people what kinds of food they eat, and then we score them, and a score from 1 to 15, with 15 being the highest MIND diet score. And then we look to see how does that relate to risk of disease. And we found in our observational studies that the MIND diet was associated with a reduced risk of Alzheimer's disease, such that people who were in the highest level of the MIND diet, which is that top line, the top little staircase line with the little dots, those are the people who reported eating the really healthy foods in the MIND diet. They were much less likely to get Alzheimer's disease compared to people who scored lower on the MIND diet. Now, we've also shown this with our studies where we look at pathology in the brain. People who have great diets, they have less Alzheimer's pathology in their brain. They decline slower on our cognitive tests. But I will tell you that we did do a clinical trial where we randomized people to the MIND diet and to just a regular diet. And we didn't really see that the MIND diet was any better than another healthy diet. So I'm not really pushing the MIND diet on you, but I am pushing just eating a good diet is good for you. It's going to help your heart. It's going to help your brain. It's going to help all kinds of things. So if you don't subscribe to the MIND diet, just make sure you're eating healthy foods, whatever your diet is. I think that's sort of the take-home message. We also have looked at things like stress, because we know that stress is a killer. And so we have a questionnaire in our study where we ask people about their perceptions of stress. And the questions are like, the degree to which you find your life uncontrollable, unpredictable, overloading, things that kind of just slow you down in your life, right? And we found that people who reported having high levels of stress, they decline much quicker, the blue lines on each of these graphs, than people who had low levels of stress. And this was particularly seen for different types of memory problems. So we found it for episodic memory, and we found it for visual spatial abilities. And so it really tells us that we need to be able to control the stressors in our life, because this is probably one of the factors that's leading to us having these faster rates of decline. So think about the things that stress you out right now, and see, are those things that you can get rid of in your life because you don't need them, and hopefully try to find better ways to manage and cope with those stressors so that you don't end up, with this fast trajectory and eventually into Alzheimer's. But on the other side of stress is the opposite of that is having a high purpose in life. We have a questionnaire called Purpose in Life, which sort of measures your overall outlook to life. Are you future oriented? Are you goal oriented? It asks you different types of questions, and then you get a score. And we found that the people who reported having a higher purpose in life, they had a delay in Alzheimer's by about 6 years. So imagine if you can delay your onset. If you're going to get Alzheimer's at age 90, but because you have a high purpose in life, you don't end up getting it until 96. I want to be in that camp, right? So how can you figure out a way to get more purpose? Many times when people retire and leave the workforce, they feel like, oh, I don't have a purpose anymore. But there's all kinds of things you can do. You may have grandchildren, you may have, volunteer activities, helping other people. There are things you can find in your life to have purpose. So please try to get some purpose so that you can stave off this disease. Now, I'll end with something that we did just really recently, because I'm telling you about a lot of different behaviors. But we know that people tend to not just do one behavior, right? They tend to do a host of behaviors in their life. So we wanted to see, could we identify patterns or profiles of behaviors that people do in their life? So we measured their cognitive activities, we measured their diet, we measured their physical activity, and we measured their social activity. And then we grouped people based on what their scores were. And we found that there were some people who were very high in all of those activities. They had a great diet. They were reading lots of books, doing lots of social activities, doing lots of physical activity. Then there were people who were more moderate in their behaviors, and then people who were just low. They reported doing very little of anything good or beneficial. And so we tried to find out, how do these different patterns relate to performance on our cognitive measures over time? And not surprisingly, we found that compared to people who were at the top level in the green bar, compared to the highest engagement group, Those in the low group, in the red, had the fastest rates of cognitive decline. Now, the moderate group, they also declined a little bit faster, but it wasn't that much different from the high group. So the message here is that try to do something. Don't be in the low group. Don't be a couch potato eating potato chips and watching TV and, not visiting your friends. Don't be in that group. Try to do something that keeps you engaged in the highest levels of activity so that you can stave off this disease. Now, this is data in hundreds and hundreds of people followed for over 20 years, right? So we're pretty confident that these findings are robust, right? But the next level is to be able to test these things in a clinical trial. That's how you really find out if something is a true factor in Alzheimer's disease. Some things you cannot put into a clinical trial, right? We can't randomize people into low social activity and high social activity. That will be unethical, right? But there's some things that you can randomize. You can randomize cognitive activity, you can randomize diet and things like that. But I think we have to start thinking about putting ourselves in the driver's seat. We have to be able to do something to change our own health. We're not just going to age and let things happen to us. And these are modifiable things that everyone can do. They don't cost any money, not a lot of money, and you can do them right here, right now. So let's all just be encouraged to do these things to change our health. So take home message, and we'll have time, I think, for questions and answers. The number of people with Alzheimer's is increasing with our rapidly aging population. Short of a cure, prevention is our best hope of reducing or delaying the impact on our society. Brain health is influenced by many factors across the life course. And I didn't talk about half of the things that we are learning that affect your brain from early life. We found so many things that affect your health there, but you can't change that. That was in the past, right? But I want to focus on things that you can do right now. So I really think that adopting healthy lifestyle habits is good for brain health, and it may reduce our risk of Alzheimer's in the long run. So I want to acknowledge the funders for all the work that we do at the Rush Alzheimer's Disease Center. We get our funding from the National Institute on Aging, the Alzheimer's Association, and the Illinois Department of Public Health, and also philanthropy. And I want to thank the study participants, because without them giving of their time, their brain, their blood, all kinds of things to us for up to 30 years now, we wouldn't have any of these data. We would not know half of what we know. So we really owe a deep, deep sense of gratitude to our participants. And the Alzheimer's Disease Center is a multidisciplinary center with, all kinds of people working on a common problem. And we all come together to try to solve the problem and find out ways to prevent the disease. And for the researchers in the room, we have our data. They're available for sharing if you want to go onto our hub and find out how to get the data and how to analyze it for yourself. So I'll stop here and I'll take any questions that you might have. Thank you so much. No questions? Oh, no questions, sorry.
You'll do questions at the panel later.
Okay.